let's go over the muscles now of the torso and the abdomen. We're going to cover the diaphragm and the psoas. The P is silent in that. Internal and external oblique, rectus abdominis, transverse abdominis, latissimus dorsi, longissimus, and transversospinal. In this Netter's plate, we can see how the muscles are in pairs on either side of the body and how they are also in layers. We have the diaphragm up here on the top, and it forms the superior border of the abdominal cavity. And you remember when we're slicing through with CT images how we come across the diaphragm and then the border of the liver. The liver would be sitting here in the upper right hand quadrant, and you would see the liver and also the air in the lungs on the sides of that liver. And that's what you're seeing when you slice through the body like this. So this is the diaphragm at the top, the upper border of the abdomen, and then we have the obliques. The internal oblique is here, this middle muscle here on either side of the body, and then we have the external oblique lateral to that, or superficial to that as well. So external oblique, internal oblique is deep to the external oblique, and then deep to the internal oblique is a transverse abdominis muscle. The transverse abdominis muscle runs around from the back side of our body all the way around to the front. It's sort of like a corset. In a couple of images away from now, you will be able to see the external and internal obliques and how they lie within the anterior border of the abdominal wall. But this just gives you an idea in cross-section along the external part of our body how these muscles relate to one another. We will see the rectus abdominis in a slide coming up, and so we'll cover that then. So the external oblique is the most external of the muscles that surround the torso, and it is a muscle of the anterior and lateral abdominal wall. So you can see here how it starts in a more superior portion of the body, and it wraps anteriorly and inferiorly at the same time. So it comes around sort of like you're putting your hands in your pockets, and it goes from superior to inferior. If you were to put your hands in your coat pockets, that would be like your external obliques coming around and wrapping around and protecting the torso. It attaches to this big swath of fascia in the front called the linea alba. Now the internal oblique is deep to the external oblique. So if you were to start from the outside of your body and work in, it would first be the external oblique here that's been cut away, and then the internal oblique, and deep to that, which we can't see yet and we'll see on the next slide, will be the transverse abdominis. You can see in this image here you have the external oblique, most superficial, and then the internal oblique deep to that, and then the transverse abdominis deep to that. And again, they are in pairs on both sides of the body. So when you are taking your test, please be sure to label right or left. On the anterior surface of the body, we have the rectus abdominis. And the rectus abdominis is at the border of the ribs. So the superior border of it is at the ribs, and then the inferior border is at the symphysis pubis. And this is the muscle that helps you do sit-ups or helps you extend and flex the body. The rectus abdominis also has this, it attaches to the linea alba in the center, and also has little bits of fascia through and through. So when people get the six-pack abs, they have actually kind of shortened these muscles or tightened them enough to where you see those striations within the rectus abdominis muscle. The internal oblique muscle, we had talked about the external oblique coming from superior to inferior as it courses, and the internal oblique goes from inferior to superior, so it's running up rather than superior rather than inferior as it runs along the body. And then the transverse abdominis is a muscle that runs around like a corset on the inside of our body, and we're going to see in a later slide this piece of fascia on the posterior side of our body called the thoracolumbar fascia, and it is the only muscle that attaches to that fascia in a direct plane, in a transverse plane, horizontal. All the other muscles attach in an oblique plane, and so the tension that we hold on our thoracolumbar fascia from that transverse abdominis muscles help keep all those other muscles happy. So it's really important to keep that muscle strong, that transverse abdominis muscle strong. We're going to take a look at the latissimus dorsi muscle a little bit later as well, but I just want you to notice how far around the side of our body this latissimus dorsi muscle comes. It really wraps around and attaches down toward the lower ribs. So it's a huge muscle in our back that helps to support the back muscles and help move our arms. Here's the transverse abdominis muscle here. It is the muscle that runs around like a corset or a support belt and helps to support the abdominal structures. It is the only muscle that does not attach to the thoracolumbar fascia obliquely. So it helps to keep the thoracolumbar fascia, the right tension on that fascia. I don't think that I may have mentioned this in another lecture, but our obliques do help us to turn our torso. And when you're turning left and right with your torso, that's what the obliques help to assist us with. The transverse abdominis muscle is an important muscle that supports the spine and also helps to stabilize it as well. And once again, you can see all these muscles here. The transverse abdominis is the most deep muscle right here. And again, these muscles come in pairs. This image of the posterior abdominal wall shows us the exit and entry points of the different vessels and structures as they come into and out of the abdomen. So remember that this is the diaphragm. And at the superior border of the diaphragm, the IVC actually exits the abdominal cavity and enters the thorax and eventually joins up with the hepatic veins and into the right atrium of the heart. So this is actually an exit point of the IVC, and it's the caval hiatus, where the IVC exits the abdominal cavity and goes into the thoracic cavity, and that happens at about T8. And then at T10, the esophagus comes down from the oral cavity and into the abdominal cavity at the esophageal hiatus, and that happens at about T10. And you can see the cruise of the diaphragm wrapping up and around the esophagus and around the aorta as well, so you'll be able to see it in both places. And then the aorta enters the abdominal cavity at about T12. And these are all approximate levels that can vary in each patient. Other abdominal structures and muscles to note are the psoas, and we talked about this before. Again, the psoas is spelled P-S-O-A-S here on the right, but the P is silent. And there is a major and a minor muscle, but I just want you to know that this is the psoas muscle here. It runs lateral to the spine in the posterior part of the body. And the iliacus muscle here is in the front part of the iliac wing of the pelvis. And then when the psoas and the iliacus muscle exit the pelvis, they become the iliopsoas muscle. I wanted to go back up to this image here so that you could see the psoas muscle. See how it is lateral to the spine? So we have a left psoas muscle and a right psoas muscle. And the ureters tend to course just anterior to the psoas muscles as they course superior to inferior. Well, we covered most of the details in the previous slide. This view in Netters gave you a better image of the psoas muscle and the iliacus muscle and how they join together just as they exit the pelvis to become the iliopsoas muscle deep to the inguinal canal. And the ureters course anterior to that psoas muscle. The psoas muscle, left and right, are lateral to the spine. This image from Netters is more informational than anything else. It shows you how this is the thoracolumbar fascia here. It's sort of a diamond-shaped wedge of fascia, and almost all of the muscles extend obliquely off this fascia. So here we got the latissimus dorsi, that large muscle that runs along the backside and wraps around to the front. We saw in the other image how it comes around and attaches sort of on the lateral side of the body. Your glutamus maximus muscles attach obliquely. You have the trapezius muscles up here that attach obliquely. Even these little serratus posterior muscles The rhomboids, everything comes off in an oblique fashion, except for, and you can't see it in this image, but the transverse abdominis muscle that comes around internal to all these muscles, deep to these muscles, and wraps around like a corset or a stability belt. But this gives you one image of the latissimus dorsi, and we'll see that more in the next slide. But it also shows you how all these muscles attach to that thoracolumbar fascia. And I've just underlined the muscles that are important for you to know. You can see how the external obliques run from superior to inferior as they wrap around the front of the body, and then the internal obliques run from inferior to superior as they wrap around to the front of the body. The latissimus dorsi is a flat, broad muscle that extends from the shoulder blade area to the top of the pelvis. So it's superior to the pelvis and a little bit inferior of the shoulder blades, although it does come up and extend just beyond the shoulder blade there. So you can see that it's labeled here. And again, you've got the thoracolumbar fascia, the external oblique and the internal oblique, just for another view of those. On this CT image here, this is the posterior side of the patient. There's the spine. This is the anterior side of the patient. And you can see how the latissimus dorsi is this flat muscle that runs from the back side of the patient around to the lateral side and attaches there. So it's a pretty big flat muscle. It's pretty easy to identify on CT images. We'll also look in the images in later slides at this erector spinae muscle, and it runs along the vertebral spines here and help keep our posture correct and help us stand tall, and they support the spine. So the erector spinae muscles, it's a group of muscles, 3 of them. The spinalis muscle here, and the longissimus muscle, and the iliocostalis muscle. Iliocostalis is the one more lateral. So this is most lateral, and then the longissimus, and then the spinalis is the most deep. You won't have to know those. Just know that the erector spinae muscle sits on the lateral side in between the transverse process and the spinous process of the vertebral body in the spine, and it sits on either side. So there's a right and a left erector spinae muscle. I realized on that first slide that I was missing the IS on the transversospinalis muscle. I was wondering why that didn't sound right when I tried to pronounce it. It is again a group of 3 muscles, the rotatories, the semispinalis, and the multifidus. So the multifidus is along the inferior thoracic spine, and the semispinalis is more the midpoint of the thoracic spine, and the rotatories is up in the cervical spine. You don't have to know that. Just know that these muscles lie deep to the erector spinae, and if we go back to that previous slide, you can see the erector spinae here and the multifidus here. There are some videos that I have subscribed to on Facebook, and I love how they show how the muscles work in the body when your body's in motion. So I'm going to try to walk you through it. They don't actually say anything in this video, at least I haven't come across one where I've actually heard them speaking, but I'll try to walk you through some of the muscles that they're trying to show you and how they're supporting the abdomen in contraction. They go kind of fast, so I may not always be able to keep up. So here's a person doing a sort of a cat and cow motion with their spine. You've got abdominal supports here in the front. There's your transverse abdominis like a corset. The back stabilizers in the back. On the left there is your diaphragm, and on the right is your pelvic floor muscles. So now they're going to tip this patient up in an upright position. And you can see those muscles that they were talking about. There's erector spinae muscles in the back and the transverse abdominis, rectus abdominis there. Internal obliques and external obliques. Sorry, that was really fast. And now they're going to spin the patient around so we can see the posterior side. So all the muscles help to support the spine and the abdominal wall as they contract. There's erector spinae. And there's your external oblique. And so when we contract all those muscles together and we pull them in as if we're bracing for somebody to punch us, We help to stabilize the spine. We're contracting pelvic floor muscles from below, muscles in our back. Everything is working together to help support those internal structures and protect them. And even when you're trying to keep your spine still, as you're moving your arms or your legs, you're contracting those muscles. In a side plank, you'd be contracting those muscles. In a regular plank, you'd be contracting all those abdominal muscles to help stabilize. If you don't contract all those muscles, then you're not supporting the spine and you end up sagging your back. That's when your back usually hurts. It's because your abdominal muscles aren't being pulled in enough to help support the spine. As you brace those muscles, you're helping to protect, you're helping to stabilize. And that's about the extent of the video.